Welcome back. I'm Valda Ford. It is my pleasure to have with me today Janet Riley-Wright, who is a substance abuse prevention counselor. Welcome. How are you?
How are you?
So good. So good to have you here. So you've been doing work with prevention and substance abuse. Let's start off by talking about maybe the depth of the problem that's in our community. I don't think a lot of people understand that substance abuse is not just something that teenagers experience or certain groups of people experience. Tell me a little bit about your agency and what you do.
Well, I am employed with Alcohol and Drug Services, and at Alcohol and Drug Services, we provide treatment and prevention services. I'm a part of the prevention program. And as a prevention consultant, one of the things that we do is educate the community and youth, businesses about things like substance abuse and what they really entail, because they're more than just marijuana and some of the things that people don't think about. Like, people don't actually look at the issue of tobacco as a substance, and it is a substance, or some of our everyday cleaners as substances. But one of our issues right now, one of the main issues and an uprising issue in our community is prescription medications.
And the abuse of those prescription medications, would you say?
Yes, abuse and sometimes simple misuse.
Simple misuse, okay.
Yes, I think many of us have been taught things that weren't quite correct. For instance, we've been told that medicine is candy.
Oh.
We sometimes, out of the goodness of our hearts, share our medications with others to save them money. And those kinds of things are dangerous.
Absolutely. As a registered nurse myself, I know that if someone has been prescribed a medication, it has been given to them with a lot of consideration about what's going on, how it will affect them, other conditions in their body.
Yes.
So if someone has been given, say, hydrocodone, which I know is sometimes abused, and they give it to someone else, they don't understand about their liver function or about other addictions they might have, they might be actually providing them with a toxic mix of ingredients that might be interfering with or adding to the effects of other things they're taking. So it's so very important for the public to be educated, and we're so glad that you're out there doing that.
Thank you. And that was totally correct, because sometimes we even have things that if someone takes someone's medicine, we don't know how old it is, exactly what it is, and how it may or may not metabolize in that person's body and could result in things as serious as death or permanent disabilities.
And I know another thing that happens is people take things that are over the counter or from health food stores that may have the same effect as prescription drugs or street drugs, and they don't realize the negative effects. And it's so important that they know more and more. I know one of the things that you have been involved with is helping people understand what to do when they're through taking their medications. If they do have some leftovers, how to dispose of them. And that concept is one that most people probably don't even think about.
I think that most people think that we're still in the day and the time of actually leaving your medicine in the medicine cabinet. I would disagree with that at this point, because those medications can be easily accessed by someone that should not have the medication. And that's usually what happens. People who are addicted to prescription drugs may make it a habit to walk into a home, look at your table, look in your medicine cabinet for those medications. And sometimes we don't get rid of our old medicines. And there are a lot of reasons that people don't. Their names are on the bottles. Yes. They don't really know what to do. Some people flush them, which is not good for our environment. Therefore, there are things that occur in the community, at least in this community, during the spring and fall, that's called Operation Medicine Drop.
And so tell me a little bit about Medicine Drop. So you're providing a place for people to dispose of their medications in a way that's safe, that makes them feel psychologically okay, because obviously you'll be getting rid of the names and all of that personal information. How did this whole concept come about?
The concept is actually something that comes from NC Safe Kids, and it involves our police officers, the DEA, and the local police officers in High Point, Greensboro, and the Guilford County Sheriff's Department, as well as our agency and some other agencies that collaborate as well, and Greensboro Beautiful.
So if I wanted to get rid of a bunch of medication, I remember when a very close relative of mine died from breast cancer, and there were all of these drugs, especially really potent painkillers, but some other things that might have helped with nausea. how would it be best for me to come to get rid of those medications?
Gather all your medications and bring them to one of the 10, I believe it is, locations that will be open on Saturday, September the 29th. Most of the Walgreens in Greensboro and High Point are participating. And just come in between 10 and 2. There's nothing that you have to do other than bring them in, leave them there. The officers and our staff will take care of those things.
Wow, that's great. So especially for a lot of seniors or people who might have multiple meds that have just gone out of date and just been sitting there, maybe they were hoping that they'd get to use them again, which is also very dangerous. So we could do a whole segment on that. But that's all they have to do is just show up, no prearranging.
No, you don't have to sign in, none of the above. Just bring your medications, bring them in a bag or however you need to bring them, however many you need to bring, and leave them at one of the locations. And from that point on, we'll take care of them.
I know it's good for us to talk a little bit more about why this is so important. You mentioned that people might come into your home, they might know that you're on certain medication, you may have just mentioned it briefly, and they are kind of stalking the house to find out. I know with young people, there used to be, and maybe there still is in this area, the issue of pharmaceutical parties, that they would go in and find mom and dad's pills, and all the kids would get together and have a big bowl and throw all the pills together, and they would just randomly take pills. Is that something that's still going on?
And that's called a farm party, and those do still go on. But one of the other things that happens is pills are sold to young people very often as individual pills. They're purchased. And people sell sometimes their own prescription or the prescriptions of others. So I encourage parents who have kids who may have medications to monitor how those medications are used, and not to give full access to the kid, but make sure they take it as they should, but monitor that use.
And so in monitoring it, it might be something as simple as keeping up with the count. So if you get 30 pills on Monday, 2 weeks from now, you should have approximately 14 or 16 pills. If you don't, then I imagine it should be your responsibility to start asking that young person what is going on here.
Yes. And by the other token, the other things that should be mindful of is that sometimes people misuse by taking more than they should. They sell or take more than they should. Or, as I stated earlier, sometimes want to help out a friend. And the friend says they have the same symptoms that that person has that has that medication. And you give that to a friend. But in doing that, you never know what those results might be. Because you don't know, you and I are both sitting here, we're both females, but we have probably very different backgrounds, different families, different health issues.
Right.
And we probably, if you take medication, take different medications. Therefore, and our body makeups are totally different. So we don't know what my medication might do to you or your medication may do to me.
Yes. Once again, if I'm going to a healthcare provider, hopefully that's how I got my medication to begin with. And even if I'm taking over-the-counter medicines or vitamins or other herbal type formulations, it's very responsible for us to know, to have someone to help us understand the interactions of all those things. I know that people who are taking, say, vitamin D, E, and K, those are fat-soluble vitamins that don't come out of your body, so you can't just pop them like vitamin C's that will just wash out of your body, and it can damage different organs.
Yes.
But you talked a little bit about the whole substance abuse issue, and you mentioned the the chemicals that might be used. What type of things are kids using or adults using that we wouldn't even think of?
That would be, those are inhalants. And that can be your basic everyday items. Hairspray, paint, hand sanitizers. It could be a number of things. And in that particular case, it's not a matter of hiding, but a matter of educating and parents securing.
And how would parents be aware? What kind of behaviors might their young people have in order for them to recognize there might be an issue?
Anytime that you see your young person is changing drastically from the person that you're accustomed to them being, you might want to pay a little attention. And I like to be careful with parents because I don't want them to get a red alert about everything.
Right.
But do look at a number of things that you may see at one time. Maybe a change in friends, maybe a need for money, having way too much money or having way too less money. may give them some signs of some things that could be going on, not wanting them to meet their friends, change in schoolwork. There could be a number of things, even change in appearance. Could be a number of things, seeing dilated eyes, tiredness, or overhyped and then extremely tired could indicate that your child is being high on some type of substance.
Okay, so I know you talked about this whole medication drop and that concept being really good for the environment. What happens when people dispose of medications inappropriately?
It allows us and everybody else, our entire community, to not have those drugs out there being sold to our children, being misused, because that's an expense to all of us. Because if you have people looking for drugs and their way of getting them is stealing them, and it can also be a hindrance to the person who may be in need of that medication. If someone takes a particular medicine, mainly pain medications, it's going to be very difficult to go back to the drugstore and convince them that you can get, or the insurance company, to allow you to get another 30-day prescription.
Right. So tell me, for those people who might not make this medication drop and have medications to dispose of, what should they do in order to make sure that it's taken care of correctly?
Well, there are other ways that you can dispose of medicine safely that you could possibly do in your own home. And one of those ways would be to dissolve the medication in water, crush the medication, and put it in undesirable things like kitty litter, coffee grinds, just any type of undesirable item that you can find to place it in so it could not be used.
Well, if I want to get in touch with you to find out more, I'm sure there'll be parents who are interested, seniors who will be interested, just everyday folks who want to know, how can I do this the right way? How would I get in touch with you?
With our initiative, our name is all over the place. We have them on buses and billboards, and that's because of the Cone Foundation. But one of the easiest ways is to go to our Facebook page or to call us. And our Facebook page is www.facebook.flipthestriprx.
Flip the
Strip RX.
RX, all right.
And our telephone number is 336-8822-125.
Well, it has indeed been a pleasure having you here today to talk about a subject that most of us probably don't think about enough, including paying attention to what's going on with our young people, including being ever watchful of the fact that we have a responsibility in making sure that more bad things don't happen.
Monitor, securing, and disposing of properly.
Thank you so much, Janet.
Thank you.
And thank you so much for being here with us today on Public Report. I hope that you've learned a lot about what we need to do, how we need to do it, and the things that are obvious sometimes once we learn them. So take care of yourself, and we'll see you next time here on Public Report. I'm Valda Ford. Goodbye.
This has been Public Report. Public Report discusses the issues of interest and importance to our viewing area. Please remember that the views expressed by our guests are their own and do not necessarily represent the views of TCT or the station.